Okay, guys, so this is the NCLEX style question. So, question number one. So, a nurse is caring for a client with heart failure who is receiving IV furosemide. During morning rounds, the client report generalized weakness and palpitation. Which action should the nurse take first? Choices: A. Request a prescription for a potassium supplement. B. Assess the client most recent serum electrolytes level. C. Obtain a 12-lead electrocardiogram or ECG. D. Auscultate the client's lung sounds for crackles. So let's answer the question. Okay, guys, so pause for a while and let's try to answer the question. Okay? Okay, so let's walk through the choices like you're actually in the moment. Okay, so A, request a prescription for a potassium supplement. So, okay, they could be hypokalemic. Should I just go ahead and ask the doctor for potassium? So hold on. So don't jump the gun. In the nursing school, we learn you have to assess first before acting, right? So you don't have to start throwing potassium at someone unless you know that they need it. So too much potassium is also dangerous too. So it can lead to a deadly heart rhythm. So while this might be a right treatment, but it's not the first thing to do. Okay, so B, assess the client most recent serum electrolytes level. So wait, so should I check their lab first? Yes, so that is what you do first. So think about like this. So if you're trying to solve a mystery, which is kind of what is nursing is, right? So you start by gathering clues so the patient feels off. So they're on a meds that messes with electrolytes, and those symptoms match up with low potassium. So you go check their potassium level and maybe even look at their magnesium and sodium too. So once you get the numbers, you can call the doctors with the full pictures. So this is the smartest and the safest first move. Okay, C, obtain a 12-lead ECG. So, well, they said their heart feels funny. Maybe I should get an ECG. Yes, an ECG can show sign of hypokalemia, like those classic Q waves and flattened P waves. But again, you assess the lab first. Then if their potassium is low, then yeah, maybe you follow up with ECG or telemetry. But an ECG without checking the labs is like checking the engine light, but not looking under the hood. So it's not wrong, but it's not just the priority in this case. Okay, so D, auscultate the lung sounds for crackles. So should I check the lungs? They have heart failure, so maybe they're fluid overload. Well, fair enough, but let's be real. So they don't say anything about shortness of breath, cough, difficulty breathing. So they said weakness and palpitation. So which scream electrolyte, so not fluid overload. So this would be important if they were showing sign of pulmonary edema, but it doesn't directly answer what's going on now. So what's the bottom line? So when the patient is on IV furosemide, complains of weakness and palpitations, your first instinct should be lay sick, will pee a lot. When you pee a lot, lose potassium. And when you lose potassium, heart gets irritable and plus muscle get weak. So check electrolytes first. So the correct answer is B. So hopefully I helped you guys. So follow for more.